This part of the DVD will tell you about the colonoscopy. This is a special test to check if your bowel is healthy. The bowel is where poo is made. Poo is the waste from your body. On the day of the test, you cannot eat any food. You can drink water or squash. You can drink tea or coffee with no milk. You will need to go to the hospital with someone who knows you well. You can choose a friend, relative or carer. When you get to the hospital, you will need to go to the reception. You will need to tell the person at the reception that you have arrived. The receptionist will ask you some questions. The receptionist will ask you to wait in the waiting room.
Thank you very much, Peter. That's lovely. If I could ask you just to have a seat over there in one of the comfortable chairs, and then the nurses will call you through very shortly.
The nurse will take you through to a room to get ready for the test.
Hello, I'm Tanya, one of the nurses. I'm going to take you through now. Okay? That's it. We're just going through there, straight ahead. There you go. Then you just have a seat again, Peter, and I'll ask you a few questions, okay?
The nurse will take your blood pressure and pulse.
Arm here. Yeah. So we'll just pull this up. I'm going to put this over your arm. Do you remember how it feels?
Yeah.
It squeezes quite a lot on your arm to take your blood pressure. So we've got to switch the machine on.
The nurse will put a small clip on your finger to check your heart rate. You will need to take off your clothes and put on a hospital gown.
Just do that up at the back.
The nurse will put a small needle in your hand. This is called a cannula.
You want me to just cut a needle on it, and as I said, it's just pretending. I'm pretending to pop it in you. Okay.
This will be used to give you any medication you need.
And then I will just show that they flush it with a bit of saline. There we are, and then this is how it goes.
The doctor will come and talk to you.
Hello.
Now then, Peter, I'm Dr. Dixon. We're going to be doing your test for you, okay? Just want to go through the consent.
He will ask you questions about your health.
Go ahead with the test. Just going to go through the consent.
The doctor will check that you still want to have the test.
Signature on the consent.
He will ask you to sign a consent form.
So we just need your signature there if you're happy for that, okay? Yeah, please, thank
The
you.
doctor or the nurse will then take you to the room for the test.
Now, you need to try and sit on the edge of the bed if you can.
Who managed that? Using the stool?
The doctor will ask you to lie on your left side on the bed.
That's better, isn't it? Yeah, definitely.
Hang on to that bar and pull yourself across a little bit.
The doctor will give you medication to help you relax and a painkiller.
A little bit of sedation, a little bit of pain relief.
Okay?
The nurse will take your blood pressure and your pulse. The nurse will put a small clip on your finger to check your heart rate.
And give you some oxygen, please, okay?
The nurse will put a small tube inside your nose to give you some oxygen.
I'm going to pop this in your nose. nose, Peter. It tickles a little bit. Okay, there we go. That's it, lovely. That'll stay there.
These things will not hurt. They are there to check that you are okay. The test will take about 30 minutes. The doctor will examine your bottom first, using a finger that has a glove on it. The doctor will then put a thin tube up your bottom. There is a small camera at the end of the tube. This will help the doctor to see inside your bowel. The doctor is looking to see if there is anything wrong. To get clear pictures of your bowel, the doctor will stretch it with air. This might feel uncomfortable. You will be able to see pictures of your bowel on a screen. The doctor might need to take away very tiny pieces of your bowel for testing. These are called biopsies. The doctor will send them to a place called a laboratory to be tested. The doctor will also be looking for polyps. These are small lumps on the bowel. If the doctor finds any polyps during the test, he will remove them. If polyps are left and not taken away, they can turn into cancer. Polyps can also bleed sometimes. After the test, the nurse will take you to the recovery room. The nurse will stay with you. She will take your blood pressure and pulse while you are resting.
My name's Liz. Is it okay with you if I do your blood pressure for you?
Yeah.
How are you feeling? Feeling pretty good, are you?
Yeah.
May I take your arm, please?
You will stay in the recovery room until you feel fit enough to get up. You might want to sleep.
Your oxygen level, okay?
When you wake up, you can have a drink and some toast. The doctor or the nurse will come and talk to you about the test. You might not get the results of the test on the day. You might need to go back to the hospital to see the doctor or nurse again. After about an hour and a half, you can go home. Your friend, relative or carer will need to take you home in a car or a taxi. When you get home, you will need someone to stay with you for about 12 hours. It might take you 2 days to get over the test. You might have wind or small tummy pains. You might have some bleeding from your bottom if you've had small lumps removed, called polyps. If there's a lot of blood or the tummy pains get worse, you will need to ring the doctor. The number you need to ring will be on the papers the nurse gives you when you leave the hospital. For most people, everything will go well during the test. Things can go wrong during the test, but this does not happen very often. The two big things that can happen are that the bowel starts to bleed or a hole opens up in the bowel. These things do not happen very often. If these things do happen, you might need to stay in hospital or you might need to have an operation. If there's any part of the DVD that you do not understand, talk to a friend, relative or carer.